Another area that is starting to emerge is social determinants of health. So, because you just touched on that, and maybe that's what you're going to ask me. But I think that would be another thing. We haven't really started doing that well, but I think we're going to. And I see that emerging for pharmacies as well, because there's reasons. And I can think of one patient I have right now that is, I guess he's my project, if you will. But so many social determinants of health going on in his life. And things I try to help him with, but one of the components of it is mental health too. And, and him choosing to accept that he needs to get some help as well. But I think that's another area, like not just asking, how are things working? But if the answer is they're not, then trying to find out why. So I do think that we're going to see more and more where us as pharmacy owners are going to have a chance to really help with the social determinants of health. And I think there are payers out there for that. And that's probably one of the things you heard at mid-year too. Well, that seems to be a direction that CPSN is moving.
Yeah, because I mean, that's where you can really get down to the root cause of so many health issues because, I have a gastric medication and a an antidepressant, and it's those are linked because I eat when I'm lonely, and there's so many different ways that you can really turn that patient's health around if you understand their lifestyle and those social determinants. Some of those challenges, especially in small communities. I remember one of our early podcasts with Joe Williams. He told me a story about how he actually went to one of his patients' house to cut down a limb that was blocking their driveway because that was a social determinant of health that was affecting that patient's ability to be mobile. But there's definitely not a SNOMED code or a billing code for removing tree limb.
There might be now. They've added so many, but no, you're right. Yeah, you're right.
So how do you see your team kind of acting on those social determinants? Have you taken that leap into what's the term, social health workers, or have you community health workers? Have you been able to task your delivery drivers with being more formally aware, or is it more kind of just a personal touch at this point?
Yes, we have not launched into community health workers yet, but that is something that we are definitely exploring. And again, it is an initiative of CPSN as well. So we have signed up to learn more and to start doing some of the training, but we haven't started doing it personally. At Baystreet, as far as a formal community health worker, I did mention the one patient, and I'll just tell you a quick story about him. So he has trouble with his car. He lives alone. It's not such a long story. He's not Medicare age. He's only 64. But my husband and I have gone and picked him up and taken him to his doctor's appointments to ensure that he gets there in time. I called him the other day and he told me again his vehicle wasn't working and he had to reschedule his appointment. Like, please remember we're here. But then he told me, I said, what about groceries? What are you doing to eat? And he said, oh, I'm doing takeout. I'm just sitting for food all the time. Pizza and subs. This guy has kidney failure and congestive heart failure. Like, I'm terrified for him, but it's so hard to get through to him that he needs to do something different. So again, you can only do so much, but I think in some ways we do a little bit of that community health worker thing anyway. And that was my point. But we're not doing it formally for a majority of our patients yet, but we really do want to move into that. And I'm so appreciative for Trip Logan and others who have really just set the standard as far as community health workers, because I do think it's a huge component of healthcare and an area that pharmacy really should embrace, again, because of those relationships.